it is far more likely than not that Boogie actually does have cancer. Destiny's argument relies on 4 points, 2 of which are instantly disprovable, and we'll get there, and the other 2 depend entirely on assumptions and guesswork. To be clear, I am not defending Boogie as a person. Likewise, this is an argument in good faith, and I in no way have any desire to attack Destiny personally. That said, let's begin. The 4 points are as follows. Point number 1.
The first was that taking an exogenous hormone, TRT, testosterone, that caused a increase in him developing this condition. So taking testosterone will not cause you to develop a cancer. That isn't not for this particular cancer. It won't. It will cause you to develop secondary polycythemia.
Boogie claims that testosterone replacement therapy helped cause his condition. Testosterone replacement therapy cannot cause cancer, but it can cause secondary polycythemia. Point number 2.
The second thing that he mentioned was that his doctor ordered a sleep study. That's because one of the things that can cause your body to produce more red blood cells is if you have hypoxemia.
Boogie was ordered to undergo a sleep study because he has hypoxemia. Hypoxemia does not cause cancer, but it does cause secondary polycythemia. Point number 3.
All of the things that Boogie described, both the things that cause this and the treatments for it, are consistent with secondary polycythemia. None of these are consistent with cancer.
The causes and treatments Boogie described are for secondary polycythemia, and none of them are consistent with cancer. Point number 4.
2 years ago, you said that you had a cancer diagnosis, but now you've just said now they're doing a biopsy to check for cancer.
Confirmation.
Is this House MD? Are we treating a blood cancer without actually confirming it yet? For 2 years, you've been having a cancer treatment without confirming there's actually cancer there?
Boogie is inconsistent, claiming he was diagnosed with cancer 2 years ago, yet he's only just now getting a biopsy to check for said cancer. Now let's actually look at the 2 conditions that we're talking about, those being polycythemia vera and secondary polycythemia. Secondary polycythemia is non-cancerous. It is a disease that causes your body to overproduce red blood cells, and it's caused by a lack of oxygen in your blood from things that are external, such as COPD, sleep apnea, and so forth. What's important is that the cause is external. This can be diagnosed by first identifying how high your red blood cell count is, and then determining how high your EPO levels are in your blood. EPO stands for erythropoietin, which is a hormone that basically it's what causes your bones to effectively produce red blood cells. And high erythropoietin is a sign that your bones are fine and you have secondary polycythemia. Which brings me to polycythemia vera, which is the cancerous variation of polycythemia. Only this time, instead of being caused by external factors, it's caused by one very important internal factor, that being a mutation in the JAK2 gene. Similar to secondary polycythemia, polycythemia vera can be diagnosed by identifying first the abnormally high blood cell count, and then the abnormally low EPO level, and most importantly, by identifying through blood markers the JAK2 mutation. A biopsy is entirely unnecessary for both the diagnosis and treatment of polycythemia vera. In summary, they are the same disease, polycythemia, just with different causes. The cancer being caused by this JAK2 mutation, and the non-cancer being caused by physical fitness issues. Now, undoubtedly, Boogie is someone who meets the criteria for having poor physical fitness, which is why it's such an easy assumption to believe that he has the non-cancerous secondary polycythemia over the cancerous polycythemia vera. This assumption is entirely faulty though, and I'll address that once we get to points 1 and 2. For now though, we need to refute points 3 and 4, which were the quote-unquote instantly disprovable points at the top of the video. Once again, here's point number 4.
2 years ago, you said that you had a cancer diagnosis, but now you've just said now they're doing a biopsy to check for cancer.
Confirmation.
Is this House MD? Are we treating a blood cancer without actually confirming it yet? For 2 years, you've been having a cancer treatment without confirming there's actually cancer there?
As we just established, a biopsy is entirely unnecessary for both the diagnosis and the treatment of polycythemia vera. So point number 4 is invalid. Point number 3.
All of the things that Boogie described, both the things that cause this and the treatments for it, are consistent with secondary polycythemia. None of these are consistent with cancer.
As we just established, polycythemia causes the same issues, whether it is the cancerous variation or the physical fitness variation. Specifically, it is the complications that result from having an overproduction of red blood cells. Therefore, the treatment of this overproduction of blood cells will be identical between both diseases, which is exactly the treatment that Boogie describes here.
How are they treating it, Boogie?
blood tests, blood thinners, bloodletting, medications.
Bloodletting.
They're trying to get my weight
Correct.
down. I'm
Yes.
seeing the doctor every 3 fucking months. I'm doing blood tests every fucking month. We're doing it.
So to claim that the treatments Boogie describes do not apply to the cancerous variation is either a result of outright lying or stupidity, or either way. This was one of the frustrating moments I referenced at the top of the video, and it's just like you're accusing a guy of faking cancer and you don't do even the most basic of research. Once again, not trying to be antagonistic, but come on. Number 2.
The second thing that he mentioned was that his doctor ordered a sleep study. That's because one of the things that can cause your body to produce more red blood cells is if you have hypoxemia.
Destiny argues that the sleep study was done because Boogie has hypoxemia or some other underlying cause of secondary polycythemia. And the sleep study was only ordered because he only has secondary polycythemia. This claim is entirely dependent on a brief segment in Boogie's cancer announcement video. And I emphasize brief because there was very little information that went along with it.
Especially at the stage I'm at, all they really want me to do is get a sleep study done, a colonoscopy done, and start taking an aspirin. So that's pretty cool.
It is definitely possible the sleep study was to diagnose the cause of his secondary polycythemia. However, this assumption ignores very critical information. First, patients with polycythemia vera can also have secondary polycythemia. Following up a cancer diagnosis with a sleep study would effectively rule out the possibility of having both variations. Likewise, sleep apnea will dramatically exacerbate the cardiovascular issues with polycythemia vera, making a sleep study necessary for care. Second, polycythemia vera comes from a mutation that occurs later in life, most commonly between 40 and 65 years of age. Boogie is 49. Likewise, Boogie has had the health conditions that would cause secondary polycythemia for his entire adult life. Secondary polycythemia can occur at any age, making it odd that he would only receive a secondary polycythemia diagnosis at the exact right age for the cancer's variation, despite 30 years of extreme obesity without it. This leads to point 1.
The first was that taking an exogenous hormone, TRT, testosterone, that caused a increase in him developing this condition. So taking testosterone will not cause you to develop a cancer. That doesn't, not for this particular cancer, it won't. It will cause you to develop secondary polycythemia.
Secondary polycythemia caused by TRT presents itself in the first 2 to 6 months of using TRT. Boogie got his diagnosis after being on TRT for more than 7 years.
And when I started taking that testosterone supplement 7 or 8 years ago, however long it's been,
Putting Destiny's fully refuted argument to the side, Boogie completely collapsed in on himself. The only way we'll truly ever know if he has cancer or not is if he shows us the medical records, and he's never going to do that, allegedly. This is obviously very suspicious, but Boogie is known for his severe psychological problems, and specifically his victim complex. And what better way to be a victim than to have the entire internet attack you for faking cancer when you actually have it? Finally, I would argue the best evidence we have that he's actually telling the truth is how well he understands his own condition, which I would argue far exceeds his intellectual ability to lie. Judge for yourself.
Because 2 years ago, they told me I have polycythemia vera based on the fact that I had increased red blood cell counts, increased hemoglobin, and the hormone markers in my blood. And it all spelled pretty definitively that I have this. And so he wanted to get a bone marrow biopsy, but it is intrusive and expensive, so they decided to forego it. I would like to still get it done. When you have the hormones, when you have the hormone in the blood that is produced by this cancer, it's pretty goddamn definitive. You treat polycythemia vera almost identically to the way that you treat polycythemia, because you can't attack the cancer directly. All you can do is treat the symptoms. And the symptoms are identical to polycythemia, because it's the same fucking thing, with the exception of one's getting caused by an external source and the other's being caused by fucking cancer. And in this case, it's getting caused by fucking cancer.